Hello, everyone, and welcome to this audio podcast as part of a Labside Archetype, a Labside Archetype edition. This is an audio podcast as part of another radio edition under Storm Lobostics production, and this is an audio podcast as part of a Labside Alchemy, and this is an audio podcast as part of another Bostics Blast. In this audio podcast, there will be an overview looking at works that originally was developed developed and sort of had early workings from between 2000 and between 2003 and 2006. And this works was revisited in around 2023, in early 2023, and was presented at the International Pediatric Transplantation Association, or IPTA 2023, and this looks at transplant immunobiology and looking at a chronic kidney disease or CKD review. So in and around the background to this works, patients having been diagnosed or who are diagnosed with CKD or chronic kidney disease may be compromised owing to restrictions across pathophysiology and immunological paradigms. CKD patients live with the threat or impairment of functioning, such as lack of energy and impaired cognition. Those in CKD in stages of severity aligned to stages 4 and 5 can have consequences across several dimensions which transcend pathophysiological abnormalities. In around the aims and objective, this work aimed to outline the central mechanisms in CKD patients. The mechanistics of this works, Hansen's theoretical propositions and empirical findings provided the principles used in coping and stress research, and are often cited in scientific and clinical bases regarding both the general adaptation syndrome from 1936 and the biopsychosocial model from 1977 by George Engel, and the hypothalamic pituitary adrenal axis HPA overactivation occurs during times when patients undergo stressful situations, and this can potentially affect T cells and markers through immunosuppressive effects of the glucocorticoids glucocorticoids. In around the conclusions of this works, linking endocrinology such as cortisol, adrenal corticotropic hormone or ACTH, and cytokines may prove advantageous in prospective investigations, and further patients with CKD patients with CKD or CKD patients whom have intense periods of stress and having to utilize resources. This may have specific effects regarding to immunological components and neuroendocrinology. For example, in CKD patients undergoing different forms of renal replacement therapy or RRT, laboratory investigations are required to explore or understand how particular immune and neuroendocrine cells are prompted surrounding tolerance in CKD population. In around terminology, specific terminologies around this, around similar works. Terminologies include physiology, chemokines, endocrinology, immunology, and chronic kidney disease. Thank you for tuning in on this audio podcast as part of a Labside Archetype edition. This audio podcast is part of a Storm Robotics production, and as part of an audio podcast as part of a Labside Alchemy and a Bostics Blast. Thank you.